I'm thrilled to introduce tonight's speaker, Dr. Ann Hohenhaus. Dr. Hohenhaus is a staff doctor in AMC's oncology service. She's double board certified in oncology and small animal internal medicine. She's also a certified veterinary journalist. She's written for many news outlets, and she hosts a monthly radio show on SiriusXM. That's really great. I recommend it. And Kimberly and I are very, very fortunate to have her as our go-to expert and advisor. She's a tremendous help to us all the time, and was a huge part of getting this pet health library launched. So thank you again, Dr. Hohenhaus, for that. And best of all, Dr. Hohenhaus is the foster mom and the camera operator of our hugely popular kitten cam, which we are hoping to bring back very, very soon. And she has a wonderful presentation in store for everyone tonight. I think you guys are really going to enjoy it. So without further ado, Dr. Ann Hohenhaus.
Thank you so much, Kimberly and Michelle, and welcome to everyone. While I share my screen, let's see, share, I think this will do it. So at our house, this program, Mythbusters, was one of our longtime favorites. And so I decided that I would turn Mythbusters, the TV show, into Mythbusters, the Feline edition. And thanks to my husband, who spent hours putting cat heads on the stars of Mythbusters. So just a little bit about me. I am a veterinarian. I've worked at AMC for a long time. This is my most favorite picture of AMC. It was taken by a veterinarian who works for the Air National Guard, and he took this picture while he was flying over AMC in a helicopter and sent it to me. And so I just think it's a really special photo because it's one of the few photos that actually shows the entire building. As Michelle said, I've had a lot of foster kittens. The last two that I had were my 74th and 75th foster kittens over about the last 10 years. But this year, because of COVID-19, kittens aren't as plentiful. And the ASPCA, who is the group that I work with, is not sending out as many kittens, and there are also more fosters, which is a really good thing, but it means that there's less kittens for me to have. So when I come back from a little time away in August, hopefully there will be some kittens for us. And as kids go back to school and stuff, parents might not have as much time as they do now. So I'm hoping that we'll have more kittens for the kitten cam. I'm board certified both in oncology and small animal internal medicine, and I spend my time doing about half and half. And remember that cancer patients often have other problems as well, so the dual certification is a good thing in my every day-to-day. So tonight, well, let me start by saying this is Jeffrey. This is Jeffrey when he was a baby. Jeffrey's now much bigger. Jeffrey's on a diet, actually, because he's so much bigger than he was in that picture. And food is an important thing in our lives and our cats' lives. And so cats and food is going to be one of our topics tonight. And we're going to talk about dairy and vegan diets. We're going to talk about cats and illness, veterinary visits, and diabetes. And then we're going to talk about cats and physics. And I have to tell you, I'm not the best physicist, and I can't believe that I'm giving a talk that even has the word physics in it. But there's some wonderful things about cats and physics. This is one of my most favorite photographs or series of photos. It's called Cat or Croissant. I wonder how many croissants these people had to go through to get the right croissant to match the orange cats. So our first statement is milk is good for cats. This is one of my favorite paintings. It's by an artist named Balthus. And I just think this is a terrific cat with his lobster and his fish and a rainbow with fish coming out of it. It's just a crazy painting. And this painting was on exhibition at the Metropolitan Museum of Art a couple of years ago. And that's where I saw it and fell in love with it. So this is one of my actually one of the first foster kittens that I had a pregnant queen, and she had 7 babies. 1 was born dead and the other 6 lived. And this was Creole. And Creole, when she's born, as where all kittens are born, is they have an enzyme called lactase. Now let's see, I think I can set up a pointer right here. Okay, so when cats are born, they have this enzyme lactase that converts lactose, which is a milk sugar, into glucose and galactose. And then as Creole or any cat grows up, and this is Creole when she's all grown up, isn't that terrific? Most people don't have baby pictures of their cats. The cats lose the enzyme lactase, and eating milk can give them an upset stomach or diarrhea. And I actually think I did that with the last 2 kittens, foster kittens that I had. They were terrible eaters. I have never had kittens that was so hard to get them to eat. And the only way I could get them to eat was to mix the Feline, the kitten milk powder in their food, and then they would eat their food. And all of a sudden, the kittens who I changed nothing with had horrible diarrhea. And I realized that they probably had come to the point in their life where their lactase was waning, and the dairy that I was adding in the form of the kitten milk replacer was giving them diarrhea. So I'm sure this happens in real cats. This is just not a theory. So then, milk is good for cats is actually a myth, and cats may love milk, but adult cats have low lactase levels and do not digest milk well. So milk is not always, dairy is not always a good idea for cats. This is one of my own cats. This is a Himalayan named Zippy. He was a disaster of a cat, but he was just darn cute. So the reason that you go to Petco and you find something that's called cat milk in these little boxes and bottles is because if you look, you'll see that this is low in lactose because cats are lactose intolerant. So you can buy these cute little cat milks if you want to give your cat milk to drink, or it entices your old cat with bad kidneys to take in more fluid. But you don't really have to feed them cat milk. You can certainly feed them lactose-free milk from the grocery store. However, if the only person in the house that's drinking the lactose-free milk is the cat, these little containers are really convenient, but they're also way more expensive than buying lactose-free milk in the grocery store. So this is one of my patients, Cuddles. Cuddles was incredibly photogenic, and her owner was good with a camera. And I just love this picture of her sitting next to the canister, the Delft blue canister. So this next myth to talk about is it's better for the environment if everyone, including the cat, is vegan. And that's one of the reasons that people embrace veganism, is that when you eat meat, a lot of the pollutants that are put into the air and water come from raising chickens and hogs and cattle for food for people. Methane is produced in high levels by cats. Fish farming adds pollutants to the ocean. So being a vegan has some definite environmental benefits for the planet, but what does it do for your cat? So we're going to talk about 4 different kinds of diets. There are probably more than that, but this is a good place to start. A vegan diet means no dairy, no meat, only vegetables and plant proteins. A vegetarian diet might include things like eggs and cheese and milk, which is not part of a vegan diet. A pescatarian diet, like this cat in this Japanese woodblock print here, this is a pescatarian cat because you can see it's waiting to eat those koi fish that are in the pond. And then an omnivorous diet is more like what the typical human eats, which is some plants and some animals. So looking at this particular study, they asked people, what do you feed your cat? And so the red bars are meat-based diet, and on the x-axis, you see it's what the pet owners eat. So vegan pet owners, there are some that feed their cat a plant-based diet, but the most vegan pet owners, vegetarian, pescatarian, and omnivore pet owners, feed their cats a meat-based diet. So currently, this is the standard, is feeding a meat-based diet to cats. So why do most cat owners feed their cat a meat-based diet? Well, part of the answer is cats are built to eat meat. And this is what the dentition or the tooth structure of a cat is. Cats don't have very many teeth. And that's because if you're a meat eater, you just need to kill your prey and then rip it up enough that you can swallow it down. You're not like a cow where you need to chew and chew and chew to break down hay and grass and forage. You just need to get the prey down your throat, and your digestive system will take care of the rest of it. And so cats only have 30 teeth. The adult cat has 30 teeth. The adult dog has 42 teeth because dogs are not carnivore. Well, dogs are more omnivorous than carnivorous. Cats, on the other hand, are what we call an obligate carnivore. And cats also, another adaptation that a cat has to eating a meat-based diet is they have a very short digestive tract. So I'm sure everyone's heard that a cow has like 4 stomachs, and there's a reason for that, because it takes a lot of digestive power to turn grain and hay and grass into the nutrients to keep that cow going, whereas digesting protein is pretty simple. And so the cat has a very short digestive tract because it doesn't take much digestion to turn the meat into the protein or the amino acids that the cat needs to keep going. So in this same study that I showed you about what are cats eating today, they also asked the client or the cat owners, would you feed a plant-based diet? And notice that most everyone of the food categories, the vegans, the vegetarians, the pescatarians, and the omnivores all said yes. In green, we would consider feeding our cat a plant-based diet. And the study also asked why. Why would you consider doing that? And one was so that animals didn't have to be food. Another was this is good for the environment. And a third reason was they perceived that this diet might be more healthy for the cat. Then for those people who said they wouldn't choose to feed the cat a vegetarian diet, they said, well, why not? And the people were concerned about nutritional adequacy, and also they were worried that the diet might cost more than the current available cat foods. So a wide variety of reasons go into people's decision for what they're feeding their cat. Now, why do most cat owners feed a meat-based diet? Well, cats are what we call an obligate carnivore. They have dietary requirements that come solely from meat in their diet. And this photograph here is what the ophthalmologist sees when they look in the back of a cat eye. So you see this dark structure here is the optic nerve, and these kind of squiggly structures are the blood vessels that feed that very important nerve, because it's this little teeny tiny nerve that allows you to see. This cat has this big funny spot here, kind of cigar shaped in the back of their eye. And that's because this cat didn't get enough of a required amino acid for cats called taurine. And when cats don't get enough taurine in their diet, their retina gets a big defect in it, and that part of the eye can no longer see. So cats need this amino acid that dogs don't need and people don't need, called taurine, and taurine comes from meat. So there are a certain number of nutrients that are found only in meat or in low levels in plant-based diets that cats require. So we've talked about taurine, and you get that cigar-shaped lesion in your retina. But also cats that are deficient in taurine develop a very weak heart muscle and go into heart failure, that if someone doesn't figure out that that's the problem, those cats will die from heart failure. They also have a requirement for other amino acids besides taurine, and my favorite was called feline, but they also have a requirement for methionine, cysteine, and lysine, and those amino acids are not found in very high levels in plant-based diets. They also need arachidonic acid, niacin, vitamin B12, and vitamins A and D, which are in much higher levels in meat than in plant-based diets. This is a chart from a study published in the Journal of the American Veterinary Medical Association. And the details on this chart are maybe not so important as what I will underline here in red. And every underlined mark in red is a diet, a vegan diet that's marketed for cats that does not meet the minimum requirements set out by AAFCO for cats. So AAFCO, this AAFCO here, stands for the American Association of Feed Control Officials. And they're the people that define what is a nutritionally adequate diet for animals. It could be for cows, it could be for horses, dogs, cats. And when you buy that can of cat food or dog food and it says this diet meets the nutritional requirements set out by AAFCO, that's who they're talking about, the American Association of Feed Control Officials. And you can see both vegan diet A and vegan diet B did not meet the nutritional requirements for cats set out by AAFCO. And you see some of the things that we talked about here. You see both diets are deficient in methionine, they're deficient in taurine, they're deficient in arachidonic acid. One diet is deficient in B12. So there's some serious issues with trying to make your cat a vegan because of the very special and unique dietary requirements that cats have. And those dietary requirements come as a result of the fact that cats are obligate carnivores. So then feline vegan diets for cats were deficient in proteins, specific amino acids, arachidonic acids, vitamins, and minerals. So then it is absolutely a myth that it would be better for your cat if your cat was a vegan. In fact, a vegan diet runs the risk of making your cat very, very, very sick. And so we don't recommend vegan diets for cats at all. And that's the end of cats and food. So I'll stop here and ask Kimberly and Michelle if we have any questions in the chat box, because I can't see the chat box.
Thank you so much, Dr. Hohenhaus. That was great. We do have some questions. One, Lori's asking, I've heard some cats are allergic to fish. Is it okay to feed only fish?
A pure fish diet probably would not meet your cat's requirement. So you cannot just open up a can of sardines, plop it in the bowl, and think you're meeting your cat's nutritional requirements. Fish diets also, when they get rancid, can have an enzyme that crops up in them that destroys thiamine. So there's some concerns about pure feeding a total fish diet and thiamine deficiency, which causes neurologic signs in cats. But an allergy to fish, I think, is possible. If pets have an allergy to a food substance, it is most often the protein substance in the diet. So fish would be a protein substance, but it could be beef or chicken or lamb. But since fish is in a lot of cat foods, it's very possible that a cat could have a fish allergy or a fish intolerance. And they're not the same. An allergic reaction is an immune reaction against a protein in the diet. Whereas an intolerance is like, I'm sure I'm not allergic to dried apricots, but oh, am I intolerant of dried apricots? They give me the worst stomach ache ever. And so I'm not allergic, it doesn't cause an allergic reaction. It just makes me feel really bad. So there's a difference between those two food-related disorders.
So we have another question, and this time it's about a raw food diet. So Claudia is asking, what are your thoughts about feeding commercially produced raw food that is specially prepared with ground up bones, organ, and muscle meats?
So veterinarians are not wild about raw protein sources for animals. The reason we cook food, and mostly it's cooked protein sources. Raw carrots are probably not going to make you sick. It's the protein sources because they carry microbes that can make your cat sick. Your cat can get salmonella just like you can from eating raw meat. They can get E. coli from eating raw meat. And so veterinarians are really concerned with food safety, and therefore we're not wild about raw diets because of the safety risk. The other thing to keep in mind about the raw diet that you're feeding your cat is that raw diet is in your kitchen. And if you don't wash the spoon or the cutting board or the counter or whatever that diet touches, and then it touches the human food, you can get sick from your pet's food as well. And that's especially concerning if you have any immunocompromised people in your household, or if you have small children who might get sicker than the typical average healthy adult. So the raw food diet for dogs or cats, you have to take into consideration not only the animal that's eating the food, but also the people that might be exposed to that food. And so as an oncologist, I always recommend that my cancer patients don't eat raw food diets, because when they're prone to infection from their chemotherapy, then that raw food diet could carry something that would make them really, really sick.
Okay, thank you. We also have a question. How about grain-free?
So I asked cardiology that question the other day, because there's all this concern about dogs and grain-free diets and cardiomyopathy. And nobody really knows what the problem is there. But right now, we're not recommending grain-free diets for dogs. I asked cardiology if they thought there was an issue with cats eating grain-free diets, and they just said, we just don't know. So the FDA has not put out any warnings about grain-free diets in cats. The warnings are grain-free diets in dogs. But I think cardiology wasn't, oh yeah, just go ahead and feed your cat a grain-free diet. So I think cardiology has some concern in the back of their mind that that could be problematic for cats as well as dogs. But since we don't know what the problem is, it's really hard to give good advice, because all we know is that these heart problems are associated with the diet. It doesn't mean that it's a cause and effect.
So to get back to what we were talking about a little bit earlier between the difference between allergy and intolerance, we have somebody asking, would lots of scratching and licking indicate a food allergy in a cat?
It could. It could. Scratching and licking is an indication of some sort of allergy. Now, whether it's your cat's allergic to the feather pillows you have or the wool blanket that you have, mold, dust, pollen, cats are allergic essentially to the same things that people are. And so it could be food. It could be something in the environment as well. Could be your dog.
Okay, this is the last one in nutrition that we'll take. How about goat milk?
Well, I think goat milk has lactose in it. Milk is milk. So I think that cats would have a problem with goat milk simply because they lack the enzyme to digest the milk sugar. Okay.
Great.
Thank you. So now we'll go on and we'll talk about cats and illness. I had a client once who was a cartoonist, and this is one of the cartoons that he gave me, which I just always thought was so cute. It was a little cat hiding behind his necktie here. This is a cat outside the British Museum in London, where none of us will be going anytime soon, unfortunately, but it was a handsome cat. There is clearly a huge belief amongst cat owners that cats only need to go to the veterinarian when they're sick. And how do we know this? Well, this is from the Catalyst Council, their 2005 document called Stats on Cats. And for every 1.6 visits to the veterinarian a dog makes, a cat makes only 7/10 of a visit. So dogs go to the veterinarian twice as often in a year as a cat does. And so for me, that makes me say that cats are medically underserved. And yet, if we look at the stats on cats, we see that 60% of cats have dental tartar. We know that 25% of our cats are overweight. And just to remind you what my definition of overweight is, it is a cat who is pear-shaped or sausage-shaped and has no waistline and has that cat udder back here when they walk that swings and bobbles because they have too much fat. And so the ideal cat is, to me, the veterinarian, is probably to most cat owners too thin. But this cat here is the perfect cat specimen. 1 in 10 cats has an upper respiratory infection. Isn't he cute? This is Sebastian. And feline arthritis has increased 67%. Kidney disease is 7 times more common in cats than in dogs, and yet the cat goes to the veterinarian, or the dog goes to the veterinarian twice as often. So I think I can clearly convince you that cats are medically underserved, but what do the experts recommend in preventive healthcare guidelines for cats? So this is just a quick summary of the AVMA, which is the American Veterinary Medical Association, and the American Animal Hospital Association is AHA, their preventive healthcare guidelines. And they recommend that a history and examination of a cat include an assessment of medical conditions, screening for infectious and zoonotic diseases, a plan for parasite prevention and control, dental care, genetic, breed, and age considerations, a behavior assessment, and a nutritional assessment. And I think most cats are probably not getting this. If you look at the feline life stage guidelines that come from the American Association of Feline Practitioners, they recommend that minimum database for cats include a complete blood count, a chemistry screen, a urine sample, T4, and that is got a little star by it because it depends on age, as does blood pressure. I don't think that no veterinarian in their right mind would think they could get a blood pressure on a 8-week-old kitten, and it's probably not necessary. Retroviral testing for everybody, and a fecal exam, especially in young cats. And again, I don't think these cats that are being seen less than once a year are getting this level of care that's recommended by the feline specialist. If you go further into the feline practitioners' feline life stage guidelines, they recommend a minimum of annual wellness examinations and consultations for all cats is justifiable. Semi-annual wellness exams are often recommended for all feline life stages by veterinarians and veterinary organizations. And certainly that old cat who's got hyperthyroidism and their kidneys are teetering and they're losing weight, that's a cat that you need to see more, or I think I need to see more often than once a year in order to stay on top of those problems. Today I saw one of my almost 20-year-old cat, and I had her blood pressure all controlled, and all of a sudden today, her eyes, her blood vessels in her eyes were all puffy and swollen, and she's lost some weight, and her blood pressure was 260 instead of 160, and I think she's hyperthyroid now. And I just saw her 3 months ago. So checking these oldsters is really helpful in trying to stay on top of some of these problems that cats get when they get older. So I think then that this is really a myth, is that cats need to go to the veterinarian a minimum of once a year, and for some cats more than once a year is an appropriate time to go to see the veterinarian. Now, we'll change gears a little bit and talk about a fairly common feline disease, and that is diabetes. And I think most people would guess that diabetes is an incurable disease. Diabetes occurs in 1 of every 200 cats, and diabetes in dogs and cats is very different. Dogs who are diabetic are much more like people with type 1 diabetes who make no insulin from their pancreas and need to take insulin injections the rest of their life. Cats, on the other hand, get fat. Remember, I just said 25% of cats in the US are overweight or obese. And cats, when they get fat, produce less insulin from their pancreas, and therefore they become diabetic because they're not making enough insulin. So they still can make insulin, and that gives us a shot to make them better. So risk factors for feline diabetes. Well, you can't change the cat you have, but we know that Burmese, Maine Coon cats, Russian blues like Pushkin here, and Siamese cats are at greater risk than just your basic old domestic short hair. Older cats are greater risk, male cats are greater risk. You can't change your cat's age and you can't change their gender. So what can you change? Obesity. 4.6 times the risk of developing diabetes if you have a chubby cat. And remember, if you think it's thin, it's probably a good weight. Inactivity. New York City apartment cats don't get a lot of activity. Cats who live somewhere where there's stairs tend to be less obese than cats without stairs because they have to exercise to run up and down the stairs. Cats who live solely indoors, but of course in New York we can't change that. Our cats have to live indoors because they'd be squished by a car or a bus or a taxi if they were outdoors. And then steroid therapy. And sometimes cats just have to have steroids to make them better. But all of those things conspire to make cats diabetic. So if you have a diabetic cat, and I had a diabetic cat for 10 years, cat probably had, we didn't know about it then, but probably had chronic pancreatitis. And this cat got insulin injections twice a day for the 10 years that I had it after it developed diabetes. I wasn't so good at monitoring his blood glucose, and this was a pretty forgiving cat. And you could tell when his blood sugar was too high because he'd be guzzling water at the kitchen bowl. Or you'd notice he was losing weight. And then the other thing that you need to do to treat your cat's diabetes is probably change its diet. Because higher protein diets seem to be beneficial in controlling diabetes in cats. So one thing that seems to help diabetic cats is that, remember, we've already talked about them being obligate carnivores. And if you, just for fun, look at the nutritional composition of a rat, you'll see that the rat is about 55% protein, 39% fat, and a dash of carbohydrate and not much fiber. I guess all the fiber comes from its fur. And so cats that are diabetic tend to do better when we feed them high protein, low carbohydrate diets. And so when we have a cat that we're worried might be becoming diabetic, and I just had to do this on Tuesday. I have a really cute cat named Mindy, and she was on steroids for her lymphoma, and she gained a bunch of weight, and all of a sudden her blood sugar was too high. So we switched her to one of the diets for diabetics, which was lower in carbohydrate. So that limits the glucose bump after she eats, and it tends to decrease insulin requirements, although Mindy doesn't need insulin yet. And it decreases what's called glucose toxicity. So when your blood sugar is too high, the cells in the pancreas called the beta cells that make insulin make even less insulin when the glucose is too high, because that glucose is toxic to those beta cells. So by feeding Mindy a reduced carbohydrate diet, higher in protein, we were so happy that on Tuesday, she's lost a little bit of weight and her blood sugar was 132. So just by being proactive and changing her diet, getting her to lose weight and cutting her steroids back, we've been able to control the hyperglycemia that she had developed while we were managing her lymphoma. Now, this is a study out of Australia, and the second author on this study, Jackie Rand, is a very, very famous Australian cat diabetes specialist. And what her study shows is that cats who were treated with various types of insulin had varying resolution of their diabetes. And you can see that at the beginning, no cats were in remission with their diabetes. And each time this graph stair steps up, another cat comes off of insulin. And what you see is that glargine was the best, compared to PZI, which is a type of insulin, and Lenti, which is another type of insulin. And so when veterinarians see a cat that's developed diabetes, we're very interested in switching them specifically to this insulin glargine, because we think it gives us the best chance of getting your cat not to be diabetic anymore. This is a terrific picture here. This is one of my patients named Jill, and she got herself into a book called Letters from My Cat, and this is a professional photo taken of Jill for that book. And you can tell that it's professional because very, very difficult to take a photograph of a black coated cat and have their face have any depth in it. And you can see all her facial features because some professional photographers spent a lot of time with lighting to make her look so fabulous. So then, diabetes is not an incurable feline disease. Changing the diet, getting them to lose weight, and controlling their glucose can result in a long-term diabetic remission. But it takes a lot of work on the part of the cat owner and the veterinarian together to get that cat into remission. So the real answer is not to let your cat get fat in order to prevent it from becoming a diabetic. And that brings us to cats and physics. And so I'll stop here and answer the questions in the chat box.
All right, so let's see. So one of the questions was related to vaccinations, which is, if you have an indoor cat, why is it important for them to get a rabies vaccine?
First of all, it's the law. That would be number one. And number two, crazy, crazy things happen. So I had this discussion with one of my clients about how we need to vaccinate her indoor cats for rabies. Then they went to the country house for the weekend. Cats didn't go outside of the country house, but a bat flew down the chimney, and guess what? Oh, the cats caught the bat and killed it. So bats can carry rabies, and if your cat captures a rabid bat, then you've got a problem on your hands. Raccoons come into people's attics, all kinds of stuff like that happens. Rabies vaccines are good, and they are in general safe, and therefore, and rabies is an incurable disease, and you don't want to have to deal with the health department when your cat, tangles with a bat. So that's really the reason. The reason is to protect the cat and to protect you, because rabies is a disease that if your cat gets it, it could give it to you. And so at AMC, we use a vaccine for rabies that has been specifically developed to try and avoid the injection site sarcoma problem that came with some of the other rabies vaccinations. I have to say I haven't seen, we see very few injection site sarcomas now. Mostly we see them because we're doing a study of a vaccine against that particular tumor. So blessedly, that the change in vaccine protocols has really made a big difference. Oh, Michelle, I can't hear you.
Okay, sorry.
There you go.
Okay, there we go. Okay. At what age should cats get checkups twice a year? And what additional tests should senior cats get?
Well, some of them were on that chart that I showed you. So after probably 8-10 years of age, then you want to start looking at their thyroid test on a routine basis so that you pick up hyperthyroidism early. You want to pay attention to their kidney tests, and if their creatinine starts to climb up, that would be a clue that they should have a urine test looked at, and they probably also should have a blood pressure done, because cats and dogs probably very rarely get hypertension like we do. We just get hypertension because we do. Cats usually get hypertension because they have renal disease. And so if you start to see renal disease, then that's a clue that you need to do a blood pressure in your feline patient. I think that a lot of people think the cat is slowing down when actually the cat has arthritis. And so it's hard to say to a cat, are your joints feeling a little creaky these days? And so sometimes simply a good history is a very important tool to help me to figure out what's going on with the cat. Because if people say, well, he's not jumping up on the refrigerator anymore, and that might be a clue that the cat's developed arthritis and needs help with improving its mobility. Another very reasonable, safe, inexpensive test on a cat is putting it on the scale. If it's gaining weight or losing weight, that's a problem. And we need to figure out why that's going on and do something about it. So a good physical exam is really important. That's today when I saw this cat whose blood pressure had gone through the roof, I thought there was going to be a problem because the back of its eyes looked abnormal to me. So just having your cat examined is a really, really good test to do twice a year.
Okay, great. So let's move on to the next section, and we can come back to answer some of these questions at the end, but I know we have a lot to get to.
Okay. This is Nino and Nathaniel. They were not Siamese twins cats, but when they would curl up in their hammock, they really looked like it was a push me, pull you cat. And I love this picture of Nino and Nathaniel. This is Moby and Elizabeth. This is seconds before that table came crashing down on them. And so this myth is cats always land on their feet. These cats didn't land on their feet. They landed under the table. They were bad cats. So in New York City, we see a syndrome that we call high-rise syndrome in cats. It's not unique to New York. This is a paper, you can just tell by the last names, which have crazy punctuation. This, I believe, is from Eastern Europe. They see the same problem in their cities as we do. We also see a lot of orofacial trauma in cats with high-rise syndrome. And then when cats belly flop as they fall off the balcony or off the window ledge, they can injure their pancreas and feel very, very bad because of a fractured pancreas. This is the roof of a mouth of a cat. Yes, he has some dental disease, but that's not what we're looking at. What we're looking at here is this cat fell out of the building, and this kind of curvilinear line here is in fact a fracture of this cat's hard palate. When it landed on the ground, the force of landing on the ground and hitting their chin causes the roof of their mouth to fracture. We also see cats that fall from buildings with fractured jaws, dislocated jaws, fractured teeth, and nosebleeds. This is an X-ray of a chest of a cat, and we're looking at the cat from left to right. This is its backbone here. This is its shoulder. The black is air, and this roundish thing is the cat's heart. And what you see is there's air underneath the cat's heart. And the cat's heart should be sitting on its breastbone, which is this structure right here. And that's because when this cat belly flopped onto the tarmac, it ruptured its lung and air was leaking out of the lung and around its heart. About 90% of cats that fall out of buildings have some sort of chest trauma, either air around its lungs, which is called a pneumothorax, or black and blue marks in its lungs, which are called pulmonary contusions. We also see abdominal injuries, already talked about. Pancreas can get injured, and the diaphragm, which is this curvy structure right here that separates the chest from the abdomen, the force of falling will tear that, and all of a sudden the liver will come into the chest where it's not supposed to be. And that can be a big problem because the cat has a hard time breathing when it's got a liver in its chest. Fractures, this is a nasty one. Notice that the bone is broken and splintered into a million pieces. And then we've got some creative arts and crafts here where our surgeons have put the bones together with a series of pins across the leg, and then are holding those pins together with a medical type of super glue. When cats fall from buildings, about 25% of them have some sort of fracture, and the front legs fracture more commonly than the back legs, probably because the cat comes down on their front feet first. Now, in this seminal paper that was written at the Animal Medical Center in the mid-1980s, this paper had a physicist who helped analyze the data. And what the physicist found in these falling cats is that cats, based on their size and structure, hit what's called terminal velocity, meaning they stop accelerating, somewhere around floor 4. And what you notice is that the peak of injuries in these cats occurs between floors 5, 6, 7, and 8. And then notice that all the injuries start to decline when you hit about floor 8. And so what that tells us is that the cat, when it hits as it's reaching terminal velocity, the cat hits with greater force, probably about 60 miles per hour. And the cat does not have a chance to right itself, and therefore the cat sustains more split palates, more fractures, more thoracic injuries, and more total injuries altogether than it does if it falls from floors 1 to 4 or falls floors 9 to 32, which almost seems counterintuitive because you should think that the more floors you fall, the greater your number of injuries are. But it all has to do with the physics of terminal velocity and where that cat stops accelerating. Because once the cat stops accelerating, then it can right itself to attempt to have its feet land on the ground. Now, this is a terrific video from the Washington Post, and it's about Benny and Maggie. And so I'm going to play this video, which is short but really good. Now, let's see. Maybe the video does not want me to play it. I already tried it once, and it played just fine. Maybe I have to turn that off. There we go. He's really cute. Can you hear this?
The audio doesn't seem to be playing.
Yeah, I don't hear the
Narrate it.
audio
We
either.
could see it. Yeah, okay. You can narrate a little bit. I think we could see.
Let me just see. Nope, I don't. I turned it up. That didn't help. So what's happening is as Benny falls, he first turns his front feet down and he's using his tail kind of as ballast to help. See, his front feet are over. Oop, now he's bringing his back feet around and he lands on the ground. One more time. And it's this righting reflex that can't happen when the cat is accelerating as he falls from a height. Once he stops accelerating, then the cat can right themselves. And this video also explains why the front legs are broken more often, because that front part of the body rotates down first and not the back legs. So the cat's righting reflex is in part responsible for why they don't get injuries when they fall from very high floors, or they get fewer injuries. And it also explains why they get the face trauma, the front leg trauma, and the chest trauma, because those parts of the body are rotated around first as the cat is falling. So then, even though cats have a terrific righting reflex, they don't always land on their feet. Sometimes they land on their chin or their tummy or their legs and can sustain serious traumatic injuries. So you want to keep your windows closed if you don't have screens, and keep your cat off the balcony. And as I discussed with Michelle yesterday, don't feed the birds on your balcony or windowsill, because I have definitely seen cats who have gone off the window ledge because they were after that pigeon or some cute little sparrow that you were feeding on the window ledge. So window ledges are off limits for cats. Now this is fun. This is Jessie. Jessie's a Tonkinese, and we were following up on a corneal ulcer in Jessie, and this is the stain, which the ulcer is healed, no stain in the eyes. But because the cat has a duct that goes from the eye to the nose called the nasal lacrimal duct, the dye from the drop of stain in the eye runs down the nasal lacrimal duct and shows up on his nose as this green dye. So our last myth is cats are solid. So what's the definition of a solid? A solid is an adjective, and it is a substance that is rigid. It keeps its shape at all times. It's not liquid or fluid, and has 3 dimensions. So these ice cubes are a perfect example of a solid. So ice cubes are a solid. Liquid, another adjective. Molecules, though, that move freely among themselves, but do not tend to separate like gas. And they take the shape of their container. So here we have water in a glass, which is taking the shape of the glass and is clearly a liquid. So let's look at some cats. Solid or liquid? How about this one? A V-shaped cat. Not keeping its shape in my mind. How about a square cat? Oval cat. And a cat in a jar. So I would say that cats are liquid. They seem to be composed of molecules that move freely amongst themselves. They don't separate like a gas. Cats always kind of together, but they clearly have the ability to take the shape of their container. So then I would say that cats are a solid is a myth, and that cats are clearly a liquid. And so we've talked about cats in food, cats in medicine, and cats in physics. Does anybody have any other myths they'd like to have busted?
Thank you so much, Anne, for that presentation. It's nice to finally get a confirmation of what I've always thought, which are cats are definitely liquid.
Yeah.
So I like that you managed to touch on that for us. We have quite a number of questions, and we're just going to pull a few. And this first question that I'm going to ask is, what are things that you can do to help keep a cat desperate to go outdoors, indoors?
Oh, so what I want, except I don't have a house or a yard, is I want a catio. There are all kinds of terrific outdoor spaces that people can make, you can buy, you can make for cats. If you just Google catio, C-A-T-I-O, they're great outdoor spaces. So that would be something that if you have the right apartment, the right house, would be perfect to let a cat experience the outdoors. I think that as long as you have really good screens, my sister's cat spends a lot of time in the kitchen window, and my sister has a screened-in porch, and that cat loves to go outside on the screened-in porch. But you got to have good screens. You can't have flimsy screens, otherwise the cat will either fall out or escape. I think it's good to always consider environmental enrichment for the cat. The reason it wants to go outside is because it's boring inside. So make inside more interesting. Cats like to climb. And so cat trees, I think, are really, really important inside. Change it up. When I have foster kittens, kittens are kind of messy. So I always need a new cardboard box or a new brown paper bag or something new, or I change the toys up. I don't let them have all the same toys all the time. I put some toys away and I get them out later. And so I think that those are important things. Puzzle toys are really good. Instead of letting your cat just waddle over to the bowl and suck down its cat food, I think you can use feeding toys that encourage a cat to prowl and hunt for their food rather than just serve it up in a bowl and make it really easy to eat.
Okay. Thank you so much, Dr. Hohenhaus. We have one more myth that needs to be busted, which I think is a great way to end, that cats are not affectionate.
I don't know who is saying that. Do they have a cat? I mean, there are some cats that aren't affectionate, but my sister had this miserable cat. Well, it was miserable because it hated me. It just hated me. It loved her. And when finally there was this guy in her life and I said, well, what do you think? And she says, the cat likes him too. I'm getting married. And so different cats, just like I don't like everybody that I meet. Cats don't like everybody that they meet. But when they meet their person, they are very affectionate and love that person.
They're just more discerning, maybe.
They're very discerning. Exactly.
Okay, well, this was wonderful. And as I mentioned before, we will have this tomorrow for you up on YouTube, so you can watch it again. And we'll also be emailing you some links. So if you want to read more about this and other feline health topics, we'll be able to do so. So thank you all so much again for joining us. And thank you, Dr. Hohenhaus, and thank you, Kimberly, too. And everyone have a great evening.
You're welcome. Good night.
Thank you.